to our listening audience from across the world. And I know we've been joined by many people that are listening to us across the world and getting comments from across the world as well.
That is wonderful.
Because we're on the World Wide Web, and that means we're going live throughout the world. That's what World Wide Web stands for. And so we're getting comments from people that are listening near and far, and encourage them to continue to do that and to tell your friends about us. Tell us we're doing this program every week from 9:30 to 10. We do it live from the nursing home where I'm at in Gates County, down east. And then we have the radio station in Ahoskie, which is 970. And then we broadcast throughout the world via the internet and via local radio. So technology.
So not only is Dr. Ferguson getting known worldwide, but also Gates County and WRCS.
Absolutely. So we're going internationally here from the big town of Ahoskie and Gates County.
All right.
So they'll be calling you from overseas, wanting your autograph soon.
Hey, I'm gonna do it. Just send me the paper.
So, but it is, technology is so endless. There's you can do anything.
And that is right.
And because it's so vast and so endless, it makes a whole new avenue for doing things. We're exposing the radio program not only live, but live throughout the world in just a simple click of a couple buttons.
So years ago, we just didn't cross anybody's minds probably.
Not even crossed the mind. But it's interesting when you think about that we're able to go live on the World Wide Web and the topics we can talk about. And so many topics are going to fit the world. They're not just exclusive to the United States or Western culture. But, when you talk about depression, which we started talking about last week, and Alzheimer's disease, those are global issues. Although the U.S. and Western countries probably are seeing more Alzheimer's disease than others, but it might just be because we're diagnosing it more.
Right.
So it might not be because we have more, but because we're diagnosing it more. As a brief side note, bluezone.com is a group of scientists from across the world that studied the 5 oldest populations in the world. And what they found in those populations was almost no Alzheimer's disease, less than 1%, I think it was. And in the United States, older than 85 years old, it's 40 to 50%. And those numbers also hold for some of the Western countries as well. So I say that to say that all data is not the same across the world, but much of it is similar.
Right.
Particularly when you talk about the Western world, we have very similar diseases for the most part that they'll have in other Western world. Where some other diseases like colon cancer, that's not nearly as common in some places of the world. Breast cancer, not nearly as common in some places of the world. So there are some geographical differences. But so last couple of weeks we started talking about depression, and last week we started talking about depression versus Alzheimer's disease, and kind of comparing and contrast those two. And I think that's where we ended up last week.
I think that's where it was, where we were.
Yeah, we're kind of comparing and contrasting because there is a significant overlap between the two. And there's also an overlap between some psychosis. Is a person having psychotic? Are they having delusional thinking? Are they having hallucinations, both audio and visual? And there's some overlap there too, between those things and Alzheimer's disease. So, when a older person, a senior, starts having some hallucinations, more audio or visual, hallucination is perceiving something that might be there that's not there. A delusion would be like, say you have you got a coat rack over in the corner and there's a hat on it and a jacket. A delusion would be that there's a man standing over in the corner. That would be the delusion. The delusion is usually based on something that's actually there, where the hallucination is usually based on something that's not there. So you might have a hallucination about something that you see that's not there, something that you hear that's not there. A lot of times person has schizophrenic, they may have voices in their head, voices telling them to do things, go places, not do things. And oftentimes those voices are good versus evil, God, Jesus Christ versus the devil. Many times those voices go back and forth between those two categories. But that's just kind of a brief side note as we talk more about more dementia and more depression and how they relate to each other.
Okay.
As we've talked on several programs in the past, this time of year is the worst for depression. And I think it's pretty obvious why that would be. Big holidays, Thanksgiving, Christmas, family time. And you have family time, but your family's gone. Or you don't have the right living arrangements that you want to have, or you're struggling, or you don't have the money for the Christmas gifts, So I think it doesn't take much imagination to see why this would be a time of year that people are more depressed than others.
Exactly.
And that's pretty. Now those are on the surface issues, but I'm sure there are more issues as well. But those are pretty obvious issues on why one would be depressed. You can't do what you want to do for your children. You can't go travel like you want to travel and see a loved one or a parent or something like that, or you can't get together with the rest of the family. I think all of those are very reasonable reasons why a person might have some depression. And depression comes in all shape, forms, and fashion. It's not limited to women. It's not limited to men. It's not limited to black, white, yellow, purple. Anybody can be depressed at any time from any occupation. So it crosses all barriers when you talk about things like depression. There are some similarities, obviously, between depression amongst certain groups. Depression amongst the Native Indians is high, and alcoholism is high in that group as well. And maybe the depression leads to high evidence of alcoholism. Depression amongst African American is high, but it may be for a different reason. Alcohol is high there too, but drugs are also high in that population of people. So there are many factors that are associated with depression, and we have to take all of those things into consideration as we talk about those issues. So again, this time of year, depression is going to be more. You still there, Bishop?
Yeah, I'm here.
Okay, I heard a little buzz. I didn't know if we had lost connection.
Still here.
This time of year, depression, again, is more common. Men are more likely to take their life in the midst of a depression as opposed to women. Men are more likely to do something that's fatal as opposed to women. But depression can come amongst your teenagers, your young adults, your older adults. All age brackets can suffer from some depression. And the reason that one gets to depression can be many. But along with depression, often anxiety exists. Anxiety could come in the form of being anxious, having a panic attack, not knowing why you're just uptight about being uptight. And those things often run hand in hand as well and go hand in hand. But the one point I want to make sure I bring out is that we do have reasonable medication to treat these things. And so don't think just because you have some depression that there's nothing that can be done, there's no treatment available, because that would not be an accurate statement. But as you talk about depression, you want to put all the factors in the category, not just the medication treatment, but what are the natural treatments? Natural hormone therapy can help with some depression. Getting the proper sleep, proper eating habits, exercise, all of those things can be involved in helping depression. Identifying what's the origin of the depression and dealing with that. Well, sometimes a person doesn't know why they're depressed. They're just down and out and don't know why they're down and out. And another misnomer is when you're depressed, you go sit in the corner, you don't talk, you don't eat, you don't do anything. Another misnomer. That's not the average person that's depressed. They're still going to work every day, still doing what they need to do, but they may have a lack of drive to do that. They may have a lack of energy in doing that. They may not want to do anything extra. They're doing just what they have to do. They may be sleeping too much or sleeping not enough. They may be eating too much or not eating enough. All of those things can be associated with depression, and those are common associations with depression. And, I don't want anybody to get the wrong thought that, yes, the depressed person can be the one that sits in the corner, doesn't want to do anything, but that's more the TV picture of depression. The more actual picture of depression is kind of the ones I was just describing. And now depression can also manifest itself in any kind of physical realm that you personally have. It can manifest itself as chest pain, stomach pain, diarrhea, constipation. Any of those areas are possible ways that depression could manifest itself. And so don't think just because you have those type of symptoms that it's not depression. It could be. It could be a multiple other things too. And this is where your healthcare provider comes in to further assess and evaluate and see what other things may be going on with you.
Mm-hmm.
So back to kind of depression versus Alzheimer's disease. We talked about that some last week. I don't think we finished that topic, and I'm going to jump in at this point and talk a little about that again, depression versus Alzheimer's disease, and how they can look alike, and how the Alzheimer's patient can also be depressed. So it can be hand in hand, and not only can it be hand in hand, a person could have one or the other, or they could have both. And as we started talking last week, there are some common characteristics associated with depression, but those same common characteristics could be associated with depression. With Alzheimer's disease.
Okay.
And so let's run through those again. They call these 10 warning signs of Alzheimer's disease. Okay, so now I also told you these same signs and symptoms could represent the ones that represent Alzheimer's disease could also represent depression. And so sometimes it takes a skilled medical provider to try to help delineate which one are you dealing with. So memory loss. We know with Alzheimer's disease, you get a memory loss. And the memory loss is going to be a more recent memory loss first, and then you will lose the more distant memory loss. So first, you may have trouble remembering what you had for breakfast. Later down the line, you may have trouble remembering, birthdays or what happened a year ago or 20 years ago. But early on, you maintain that type of memory. Now, in the depressed person, they're not going to necessarily have any loss of memory, but they may have a lack of desire to come up with that memory. So if you ask a depressed person something, it may not be that they can't come up with an answer, is that they don't want to come up with an answer. They don't feel like coming up with an answer. When you say, well, what you have for breakfast? I don't know what I have for breakfast. Well, that would be a question if you ask the Alzheimer's patient. You ask them what they have for breakfast, they might give you something that's not true, or they might think and think and think. But a depressed person would ask that same question. They might say, I don't know what I have for breakfast. And it's not that they don't know, it's that they don't feel like talking about it, they don't feel like thinking about it, or coming up with an answer for you. So you may get an I don't know. But that doesn't mean they don't know. You follow that?
I surely do.
Yeah, okay, so the next warning sign, one of the common 10 warning signs for Alzheimer's disease, would be difficult performing familiar tasks. Okay, so what might that be? That might be fishing, it might be hunting, it might be photography, it might be cooking, it might be anything that's a familiar task. And so now you're having difficulty performing that. Say you usually make the best pecan pie in the world, but now you can't. Now you're having trouble getting the ingredients right, and the pie doesn't taste as good as it used to take. Or maybe you're used to be an avid fisher, or hunter, or a photographer. And now you're having challenges with things that you used to just take for granted. And so difficulty for performing familiar tasks. That's one of the warning signs that one needs to think about. These are signs that if you were to see these in your loved ones, it makes you think about, is a person coming down with Alzheimer's disease? And so you begin to have that person evaluated. And understand that the youngest person with Alzheimer's disease that we have diagnosed, I think, is 38 years old. There's another small subsegment that will come down with Alzheimer's disease between 50 and 60. And then the majority is going to be greater than 65. But so you don't want to just assume because a person's young, they don't have Alzheimer's disease, but you definitely want to rule out other things first.
Right.
Now, what's another problem that may be similar? Problems with language. Whereas the Alzheimer's person, they may begin to have problems with, language, putting the words together. They may want to, go lay down in the bed, and they may say, can you put me in the chair? And so the words may begin to have different meanings with your Alzheimer's patient, and they may also begin to have some problems with their speech. Whereas the depressed person, they may have problems with their language, but only because they're choosing to. You ask me a question, and I say, oh, I'm gonna, so I just mumble the answer. And that could appear that I'm having a problem with language, but probably it's because I'm just choosing, I don't want to answer. I don't want to talk loud. I don't want you to know what's going on with me. And so the problem with language in the depressed person is generally going to be a lack of wanting to, where the problem with language in the Alzheimer's patient is going to be because they no longer can think of the word. They no longer can think of how to put the words together. They're not coming up with good sentences. No, forgive me for yarning. I keep yarning this morning. So those could be some of those differences there. Disoriented to time and place. Okay, very common scenario. Anybody can be disoriented to time and place. You can wake up in a hotel and there's a time difference and you don't know where you are and you don't have the time right and you're confused about what's going on. But the average person is going to easily reorient. So you wake up and you're in Florida and you've been traveling a lot and you don't know whether you're in Florida, California, Hawaii, or North Carolina.
Been there, done that.
And so that's not an uncommon scenario. But the difference is the person that doesn't have dementia, they usually reoriented relatively easy. Now, the person that has dementia, they may continue to be confused about time and place. And the person that's depressed, they may also be confused about time and place, but usually it's because of an attitude of apathy, an attitude of I don't care, attitude of, well, just why don't you get done? Why don't you just finish asking your questions so you can leave? It's usually more along that line than it would be along the line of they can't come up with the time and place. And again, another similarity between depression and Alzheimer's disease. As we've been talking today, there are several similarities between them. Another problem with kind of common 10 warning signs of Alzheimer's disease would be a poor or decrease in your judgment. Now, when a person has Alzheimer's disease, their judgment becomes very poor. Over time, initially they may be fine, but what's a poor judgment? Poor judgment would be to stick a metal plate in the microwave. Poor judgment would be to go out at night in the snow to the mailbox to get your mail and you only got bedroom slippers and pajamas on. Poor judgment would be you're driving down the street and don't know how to drive and you just on the wrong side of the street. That will be poor judgment. So poor judgment can fit a lot of different categories. Now, whereas a depressed person, they may have poor judgment again because they don't feel like doing something, because they have the apathy about something. They know they need to make this call, they know they need to do X, Y, Z, but they don't do it because they just don't feel like doing it. And so that might also be poor judgment in certain settings.
Okay.
Another common warning, sign for Alzheimer's disease. Again, these are things that if your family member is displaying some of these things, you want to have them checked out. But we're also relating these same common warning signs with a person that can be depressed. That's why one of the things in the differential diagnosis of Alzheimer's disease is have you ruled out depression. Problem with abstract thinking. I know we covered some of these last week, but I think we're getting them a little more depth this week. And I think in all that getting an understanding from the questions I've had over the past couple of weeks, I think reiterating these things and reviewing them a second time is probably a positive. So we talk about problems with abstract thinking. Well, abstract thinking is opposite of concrete thinking. Concrete thinking is if I say, don't cry over spilled milk, you say, why does that mean? You say, well, the milk is spilled, so you can't drink it anymore. That's concrete thinking. If you say the grass is not always greener on the other side, well, abstract thinking would tell you that, well, things aren't necessarily going to be any better when you get to the other place that you're going to. Where concrete thinking would be, yeah, well, if the grass is not as green as this side, it's probably going to be brown. So again, that's concrete thinking. If another one, if you live in glass houses, you shouldn't throw stones. Well, the abstract thought for that would be, well, don't talk about folks because you may have the same problems. Don't take the log out of somebody else's eye before you take the speck out of your eye. So that's kind of the concept of what that means. But if you say, if you live in a glass house, don't throw stones, To a person with Alzheimer's disease, they may say you're going to break the house.
Oh, okay.
So that's the difference between concrete and abstract in their ability to think. And that's something that as a person's Alzheimer's disease gets progressively worse, they're going to lose the ability to do that. Whereas the person who's depressed, they may not have problems with abstracts at all, but they may do something inappropriate with those abstracts. So now what's the next one? Misplacing things. This is a number on the list on the 10 warning signs for Alzheimer's disease. So, who in our listening audience hasn't misplaced something?
Amen.
Every last one of us. But the difference is, can you find it again? Are you misplacing regularly? Are you misplacing now where you didn't used to misplace at all? So this is what we have to come down to. We have to come down to what's the pattern of change. Now, the depressed person can misplace things, just like the Alzheimer's patient can misplace things, just like anybody can misplace things. But what is the pattern of change? So all your life, you've misplaced your keys, and now you're 85, you can't find your keys. Well, I don't think you can stop and say that person has Alzheimer's disease because they can't find their keys, because they have never been able to find their keys. I mean, I can remember growing up with my grandparents. I don't think my grandfather ever went out the house where he didn't look for his keys. And he didn't have dementia or Alzheimer's disease at that time. He was a pretty sharp guy. But every time to leave out the house, we'd have to look for the keys. And I don't know whether it's because he used to work in a parking lot or not, and he would put the keys in all kind of different places. Maybe that's the reason. I just thought of that just now. When you work in a parking lot, sometimes you keep the keys and you put them on a hook somewhere. Sometimes you leave them in the car. Sometimes you put them different places in the car. And so maybe he was suffering from so many different places to put the keys on a regular basis that he couldn't remember where he put his. But I don't know.
I've been there too.
There could be many reasons for that. But again, misplacing things is a common scenario. And anybody can misplace things, but what is your pattern? A change in your mood or behavior. Well, obviously a person that's depressed and severely depressed, they're going to have a change in their mood and behavior. They're going to be down and out as opposed to jolly and happy. They're probably going to refrain to only doing the things they have to do, as they're getting away from the things that they might want to do. So a change in behavior, where they may have been very outgoing in the past, now they're withdrawn and kind of subdued. Now, all of these things could take place whether you be depressed or whether you have Alzheimer's disease. So pay attention to these things that we're talking about. Now, what else do we have here? A change in personality. Well, a change in personality means just what it says. If in the past your personality was happy-go-lucky and now it's stern and suspicious and fearful, all of those are things that your family can definitely help you work through. Now, as you talk about changing personality, that's also the Alzheimer's patient that maybe they used to cuss like a sailor and now they're don't cuss at all. Or maybe they used to never cuss at all and now they cuss like a sailor. So that would be a change in personality. And last on that list of the 10 warning signs for Alzheimer's disease is a person for this. So this would be a loss of initiative. That would be a desire to do anything, your drive to get something done. And the same loss of initiative could be present in somebody that's depressed, as well as somebody that has Alzheimer's disease. So this could be another one of those ones that's difficult to distinguish the difference. A person with Alzheimer's disease may become very passive. They may become very aggressive. The whole spectrum is where that person might sit when they begin to evaluate the loss of initiative. So again, initiative is your desire to do something that maybe you need to do or maybe you should do, or your desire to get up and wash the dishes. That takes initiative. Your desire to help clean the house. That takes initiative. Well, the depressed person may not want to do it because they just don't have a desire to do anything. And where the Alzheimer's patient, they may be to the place where they're only going to take initiative when you actually tell them to do something. And then they may forget what you told them to do if they're advanced enough in the process. So those are some common warning signs for Alzheimer's disease. Now, if you had any of those signs I just mentioned, by no means does that mean that you have Alzheimer's disease, but it does mean that you probably should be checked out, particularly by somebody who has some experience in dealing with Alzheimer's disease. It does mean that you probably need to get your yearly exams and make sure nothing else is going on, the blood work, the chest x-ray, the EKG, making sure there's nothing else that's present that may be causing you some of those challenges. So, any questions about any of those, Bishop?
No questions, no, but I was just thinking, the audience, before we had told them, if they had any questions, they could call the station, and we'll have someone who can fill those questions and get them to us so you can answer.
Okay. Well, again, a little more about Alzheimer's disease, because that actually was my topic today. We just happened to be cross-relating Alzheimer's disease to depression, showing how they can both look very, very similar. Well, the numbers for Alzheimer's disease are constantly changing. Older numbers said there was 4.5 million people in the United States suffering from Alzheimer's disease. That number probably is now close to 5.5 million people. In the past, it was noted that approximately 2.6 million people in the United States have not even yet been diagnosed with Alzheimer's disease. And that number is actually probably larger than that, because so often as a person's getting older, people just chalk it up to that they're getting older. And you don't stop and do a very good evaluation on whether this person may or may not have Alzheimer's disease.
Dr. Ferguson, to your knowledge, has any research been done as to why there's an increase of people with Alzheimer's?
I don't think that there may be research out, but I don't necessarily know that there's an increase. But we're diagnosing it more, we're talking about it more, we're evaluating it more.
Oh, okay, more diagnosis of it.
More diagnosis. And you think about people like President Reagan. Well, he had Alzheimer's disease. He had Alzheimer's disease when he was in office. Alzheimer's disease is a progressive downhill disease. It can last 3 to 20 years. And so when you lose opportunities like that, for him admitting that he had it, and where at least society can get maybe some choice interviews, or just meaning a poster child for gaining more understanding of that whole process of Alzheimer's disease. People get involved when it gets closer to home for them. Think about breast cancer. It's a very small number of people compared to Alzheimer's disease, and many other diseases die each year of breast cancer. But far, 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 many more die of Alzheimer's disease than breast cancer. But there's nothing glamorous about Alzheimer's disease.
Right.
Where breast cancer, it has a lot of spokesmen or spokeswomen that are pretty and popular and already in the public eye. And so when they stop to speak about something, people stop and listen. So that's a very common scenario as well, to be in that category where you just don't understand. Let's just change that topic. I think I was getting a little confusing. So back to Alzheimer's disease, it's suggested that it takes about $55,000 annually to house or take care of the expenses of somebody with Alzheimer's disease. So you can see it's not a cheap disease. It's associated with the average annual cost of Alzheimer's disease to society, they think, is about $100 billion. $100 billion with lost work, supplies that you need, hospitalization, nursing homes, home health care. They're suggesting that if you put all those numbers together, it's about $100 billion annually is what Alzheimer's disease may or may not be costing them. And this data I'm reading is actually old. It's about 10 years old. And so if that's what it was 10 years ago, imagine what it might be now. So we are getting close to the end of the time, but what I always let people know, they can reach me in my office at 252-332-6484. They can go by my website, askdrferguson.com. You can go by the YouTube site, youtube.com/user/askdrferguson. And if you forget all these things I just said to you, you can always go to the Google search window or any search window and type in Stephen Ferguson, MD, or Ask Dr. Ferguson, and you'll find so many of these things that we just mentioned. Also have a Suboxone clinic. You can find that on the internet. And lots of ways you can reach me and comment and have more questions about some of the things we've been talking about today. It's a large topic, and we can continue to talk about that next week. Want to remind people, don't forget to tune in to Talk Back Now with Patricia. I'm sure she's going to have an interesting program, whatever the topic may be. It's usually something related to politics and something related to improving the lives of those in the community around us. And, my program aims at preventive health from a health point of view. Her program aims at preventive health from maybe a more mental point of view and maybe a more understanding what's going on around you so that you can make better decisions. But anyway, on that note, don't forget to tune in to Patricia. On Mondays, I think it's 11 to 12.
11 to 12.
And then Wednesday, 11 to 12, and then Fridays, I think 10 to 11. Tune in. And on that note, from myself, be blessed. Have a wonderful day, and we'll check you next week.
Thanks, Dr. Ferguson.
All right. Bye-bye now. To our listening audience worldwide, thank you for coming. Tell your friends about us. Hopefully, I think the broadcast went reasonably well today. We've been having some technical difficulties, so hopefully that does not show up in today's broadcast. But tell your friends about us. Come join us. You can also go back and look at some of the archive ones that have taken place in the past. All right, be blessed and have a wonderful day.